Hi, for my 5-minute video, I am going to talk about the precocious puberty. Okay, what is the precocious puberty? Puberty occurring at an unusual early age may have adverse effects on social behavior and psychological development. Early onset puberty, especially in girls, is becoming a lot more common and not necessarily abnormal, but however, it can be distressing for parents and harmful for children to mature physically when they are still immature mentally. Generally speaking, less than 8 years of age in girls and less than 9 years of age in boys. What put people at risk for precocious puberty? There's often can be found really certain conditions such as infections, hormone disorders, tumors or brain abnormalities, or injury may cause precocious puberty. Um, Precocious puberty is causes are split into central and peripheral. Central causes, gonadotropin dependent, caused by premature activation of the HPG axis. This includes CNS lesion, for example, hematoma, CNS tumors, or CNS radiation, or hydrocephalus, or genetic mutation. Peripheral causes are gonadotropin independent, stems from increased secretion of the sex hormones. This can occur from the gonads, for example, ovarian cyst, ovarian tumor, Leydig cell tumors, adrenals, um, ACGs, hormone production by the germ cell tumors or exogenous sex hormones, primary hypothyroidism, or the McCune-Albright syndrome are also causes of the peripheral causes. Three key conditions or questions to ask in the physical examination components. First of all, we'll use the assess using the Tanner staging. First signs for females or breast development. Then first sign for males would be the testicular growth. We want to get a history, a thorough history, medical history, and physical exam. So including height, weight, and height velocity, whether it follows the normal pattern of the endocrine changes or not. Onset of this secondary sexual characteristic in girls, onset of the period, the first time they had the periods, recent growth, any family history of the onset or growth, detailed medication history, or assess risk factors such as child or sexual abuse. Diagnosis and treatment, height measurements, and growth charts are really important. Non-dominant hand wrist x-rays, serum estrogen and testosterone levels, serum follicle stimulating hormones or luteinizing hormone. They're usually high in the central cause and will be low in the peripheral cause. Prolactin levels, thyroid stimulating hormone levels, or free T4 levels. Screening for the chronic diseases includes CBC, ESR, and the liver function test. It's really important to get a pelvic ultrasound in all girls. Gonadotropin dependent GTPP is to diagnose to get a brain MRI evaluation of all other pituitary hormones, overnight sampling of the GnRH. GIPP is the gonadotropin independent, so serum 17OH raised in the CAH or the CT scan of the adrenal glands. Treatment will be the GnRH agonist preparation, 3-month preparation, the leuprolide starting dose will be 11.25. if puberty is not adequately suppressed, can increase the interval between doses or titrate up the dose. Children under 2 or children with hematomas often use Zippolite depot given IM every 28 days with a starting dose of 7.5. After suppression is achieved, switch to every 3 months. Monitor the response of the GnRH agonist by assessing the pubertal development and high velocity every 3 to 6 months, and bone age initially every 6 to 12 months. Generally continue the treatment until age 11 years in females and age 12 in males, but the decision to discontinue the therapy is individualized. Thank you guys for watching. I hope you learned something.